Hi everybody, Gregg Hoffman here, co-owner of Burma Pump Personal Training Studio. And in this video I want to talk a little bit about trigger point therapy. That's this bad boy here. Trigger point therapy is a little bit different from massage therapy in that it's just focusing on exactly that trigger point work. Massage therapy does some massaging, some tissue manipulation with the hands, some lotion, and it's kind of a feel-good thing, and every now and then they'll dig into some of those knots, some of those trigger points. They usually use their hands, their thumbs to do that with. And that's good. I'm not taking anything away from that. I really think that's a very good modality. But there are some times where you just simply need more. If you got some pain, some tightness around a joint, some tightness and pain around a joint, oftentimes it's because you've got some trigger point issues. You've got some knots that are building up that are preventing the muscle from working through its full range of motion without pain. And it takes some direct trigger point work to do it. Dry needling is another example along those lines. I'm going to tap on that just a second. Dry needling is similar to trigger point from my research in that it will do that same trigger point specific targeted pressure, but it does it with needles. The practitioner will put an actual needle into the skin, very similar to acupuncture, but their focus is on targeting those knots, not necessarily working with the energy meridians of the body that old school acupuncture was. So it's a similar concept to trigger point, and in my opinion it's another good tool, although that's one I think that's a more aggressive approach, that I think that just general trigger point can get the job done most likely. If not, then that's the next stage that you'd want to consider. So anyway, what is trigger point work? As near as I can tell, with the research that is done, there's a couple of theories about what's going on with the knots that you feel when somebody does some trigger point work on you and trying to break it up. One theory is that you're getting fascial tissue tightness just from simply life, using your muscles in repetitive motion over and over and over again, maybe being improperly aligned, like hunched over on a computer for long periods of time. You do that for several years, you start getting the fascial tissue around those areas tend to tighten up, maybe develop a little bit of scar tissue in them, and that leads to the knots and a lot of pain. So digging those out really go a long way towards alleviating that pain and getting things to work again. That's one theory. That's the one I think makes the most sense to me. But another theory is simply that, and this is plausible too, is that there's just energy blockages from these knots that is causing the pain. Very similar to acupuncture, and it's thinking about the energy meridians on the body. There's some theories stating that trigger point work is similar to that, and it really may be. My guess is a combination of those two. I'm going to add in one more that I think it may be, and that's simply scar tissue built up in the muscle in and of itself from repetitive use over the course of time, and the muscles can tend to get knotted up too, so they may need to be dug out, and some of those trigger points may simply be in the muscle that needs to be worked on too. Another area, surprisingly, is the tendons and ligaments. They get scar tissue buildup too. I'm finding this out from my own experience, that by digging into them, I'm getting a lot of relief too that I didn't know was there. And I think what's happening with tendons and ligaments is they just don't get the blood flow and the nutrition that muscles do, for example. Muscles tend to recover much more quickly between workouts, between use. Tendons and ligaments do not, because they don't have that blood flow. And so they do get gummed up, they do get build up scar tissue, and ironically doing some trigger point work on those areas too go a long way towards helping them heal. Tendonitis, for example, around the elbow, for me has been a big issue for several years. By digging into some of the ligaments around there, the tendons around the elbow, I was able to get a lot of relief from doing that. So I think trigger point works very well throughout the whole course of the body. How does that work? Well, this tool I find to be incredibly remarkable, because you can see the point here. It's a bit of a sharp point. So what I do, well, first of all, what I do when I start working with people is that I'll start with this edge, and I'll just kind of run it across the muscle a little bit, get the blood flowing, getting that area ready to do the work. Then after that, I'll start digging in with the point, and I'll just go down the muscle the tendon or whatever the case may be very slowly until we feel a knot and feel the person that I'm working with feels a tenderness in that area. Then we'll halt there and I'll put some pressure in it. And we tend to use a scale of 1 to 10. I'll ask the person on a scale of 1 to 10, what is the pain threshold that you're experiencing now? And a good rule of thumb I find is that if I give enough pressure to that they feel it's around a 7 or an 8 and we hold it for a little while, that goes a long way towards releasing that trigger point and alleviating the pain. Sometimes I'd say when I first start working with a client, they have some real bad trigger points and it's been a long time since I've done some real work with it, I'd bring that pain scale lower. I'd say around 2 or 3 is the level that I would use just to start, because for a lot of people they're probably just jumping from that. So that's where we would start. Anyway, that's what trigger point does. That's how it works. We put pressure on that sensitive area and dig in, and with the point it seems to work very, very well to release that knot and get the body functioning back the way it should be again. Once again, Gregg Hoffman, co-owner of Pump Personal Training Studio, Trigger Point Therapy Work.